My third myth is prescription drugs contribute to tremendous health cost increases. The real price of prescription drugs is actually decreasing. Last year, inflation rose 4%, while drug prices increased only 1%. Drug spending is a very small portion of our total healthcare spending. It's less than 11%. And drugs actually reduce healthcare costs. Frank Lichtenberg, a very well-known economist at Columbia, has shown that for every $1 spent on newer prescription drugs, we're saving $7.17 in hospital costs. I mean, today we have so many wonderful drugs for schizophrenia, for many, many diseases, and you don't have to go through having an anesthetic, having a surgery. So we want to keep the whole prescription drug market in this country free and open. The fourth myth is drug importation. Now, this is an issue where John McCain and I differ on. I was an advisor to Rudy Giuliani, and his healthcare plan was fabulous because it was based on mine, according to Teddy Davis at ABC News. But John McCain and I differ on drug importation. Brand name drugs are cheaper in foreign countries because, now this is the key thing, because their governments impose price controls. Countries like Canada, France, Germany, Great Britain, they do not do research and development on new drugs. All of the R&D from these European companies is all done in the United States. Why? Because companies have to make a profit to stay in business. Drug makers can only afford to sell drugs at cut-rate prices, controlled prices in Europe and Canada, because we Americans pay the full price. If American politicians allow foreign drugs to enter the U.S. market, they will in effect import price controls into our country as well. This is going to create practical problems like shortages, but also deny firms the return on investment that is necessary to plunge into the next round of research and development for cures. Most people don't realize to bring a drug from the first inkling of thinking about it to the market, it costs $1.3 billion. And most drugs never make it onto the market. Most of them fail in the clinical trials in step 1, step 2, and step 3. But people are willing to make these risky investments with the hope that they will get the reward. So in the biotech, the biologics, prescription drugs, medical device, these industries are buoyant in America. But if we allow drug importation and importation of price controls, it is all going to dry up. Think back to 1993 when Hillary Clinton had her Hillary Care 1.0. The venture cap money for healthcare reform dried up overnight. You know, if you look at illnesses like AIDS, heart, stroke, non-Hodgkin's lymphoma, diabetes, you know, there are tremendous amounts of work and research going on today. My uncle died from non-Hodgkin's lymphoma in Canada in the early 2000s. When I asked my cousin to ask the head of the Cancer Control Agency in Vancouver whether Rituxan, which was a new drug that was working so well for NHL here in America, would be available to him. And Rituxan, when they asked the head man, you know, if it was available, he had never even heard of Rituxan. And he got back to my cousin later and said, you know, you could take your dad down to Seattle where Rituxan is available. Now, this was the early 2000s. But I had an email from a gal in Toronto, Ontario, Canada's largest city, about a year and a half ago. Rituxan was still not on the formulary in Ontario. She could go to Michigan and spend $40,000 for her treatment. But I was able to find out that Alberta, Canada's most conservative province, actually had Rituxan on the formulary, and she was able to get it. So this is astounding, but it's a clear example of what it means when you don't have access, and when government says what drugs are available at what price. We were at a dinner party about 3 weeks ago, and the chap sitting next to me I'd never met, he was the date of our host's sister's friend. And I said, so I started asking him about his sort of life story. He had several jobs in Hollywood and in producing ads and the web and all of this. And he said, well, you know, I was talking about drug issues and his health, and he said, 8 years ago when I was 40, I was diagnosed with non-Hodgkin's lymphoma. The doctors told me I had 3 months to live, but I was able to get Rituxan, and I am now alive at 48, and he looked like the most healthy young man around. So, you know, these drugs are important, and we need to keep finding them. So we want these miracle cures so that Americans could live longer and healthier lives.